I'm Dr. Stephen Loyd, National Medical Director for Journey Pure, and what follows is my latest update on COVID-19. Before we get started with today's COVID-19 coronavirus pandemic update, I thought I would talk just a little bit about the recovery principle that I learned 16 years ago from Chip Dodd. I showed up at CPE, addicted to opioids, pain medication, benzodiazepines, and alcohol, really at the bottom point in my life. And I told Chip all these things I was worried about losing. I was going to lose my wife, I was going to lose my house, I was going to lose my cars, I was going to lose my medical license. And he didn't tell me it was going to be okay. He didn't put his arm around me and say, "That's fine, Steve, don't worry, you're not going to lose any of that." What he did do was he told me that when I got to the point where I was okay, even if I lost all those things, I'd be where I needed to be. And what he meant by that was I'm not in control. There are things I can control and things I can't control. Things I can control is my attitude, I control my reaction, and I can control my role in the events of my life that I'm involved in. Everything else is out of my control. So as we get into this update, I think this is a perfect opportunity for those of us in recovery and those of us who are not in recovery to practice these principles, because we're not in control here. What we can do is what we know works coming from our leaders, and we can reach out and help others. And if we do that, we're going to be fine. In today's update, I want to review the symptoms of COVID-19, the coronavirus. I want to review the things that we know we can do to help stem the tide of this virus. And then I want to look at priority testing. One of the things I get a lot of phone calls about, "Oh, I've had this exposure, I've had that exposure, do I need to be tested?" So I'm going to go through the priorities for testing. And at the very end, I'm going to give you an app on your phone, if you have Apple products, that you can download and answer the questions, and it will tell you what your next course of action needs to be. So those are the goals for this update. So first of all, what are the symptoms that we're looking for? Cough, shortness of breath, fever. Right now, a lot of things can cause that. Bronchitis can cause that. Influenza can cause that. But if you have any of these three symptoms, the first thing right off the bat is stay at home. Do not go out. Right? Don't come back out until you've been asymptomatic for 72 hours. You got to remember, the treatment for COVID-19 is stay at home for the vast majority of people. Only a minority of people will go on to get sick enough to require hospitalization or ICU. What can we do? Things we've heard a million times by now, right? Number one, wash our hands thoroughly for at least 20 seconds. Anytime we come in contact with virtually anything. I went and washed my cars today. And I went out to the car wash and maintained proper social distancing. As soon as I got back in the car after handling the vacuum cleaner, immediately washed my hands. I washed my hands when I got home. And one of the things that we're learning from our colleagues in New York is how important it is to not go to our face. Don't touch your hand to your mouth, your eyes, your ears, basically anywhere in the head area, as that is high risk of transmission for COVID-19. And that's coming out of what in the United States right now is ground zero. Maintain proper social distancing, at least 6 feet, and I would say 10 feet. I don't go anywhere that I can't get within, get outside of that range. Walking outside my house today, I saw a lot of people walking. Everybody was maintaining that social distancing, and that's vital to stopping the spread of this virus. And last but not least, clean thoroughly. Surfaces that we touch commonly, doorknobs, right? Countertops, any common areas in your house, clean multiple times a day. We know those are the things that work. We know those are things that are effective. And last but not least, if you don't need to go anywhere, don't. Stay at home. And if you get sick, for sure stay at home until you've been asymptomatic for at least 72 hours. So commonly asked question right now is, "Steve, I was next to somebody who is having symptoms. Do I need to self-quarantine? Do I need to be tested?" So I'm going to do my best to answer that. So there's really three priorities for testing. The first priority for testing is hospitalized patients and healthcare facility workers who are showing symptoms. Why? Because we want to maintain the integrity of the hospital. Hospital has always been a place where you can get infection. That's where the sick people go. So we need to know, do our hospitalized patients have this so we can protect our healthcare workers with personal protective equipment? And we need to know if our providers who are taking care of these folks are infected. So if people are coming into the hospital for other reasons, and you have to remember the vast majority of the people in hospitals right now aren't there for COVID-19. They're there for other reasons. We don't want them getting infected from a healthcare worker. So that's priority number one. Priority number two are patients in long-term care facilities, patients who are 65 years or older with symptoms, patients who have underlying health disease like chronic kidney disease, chronic lung disease, chronic liver disease, or any disease that compromises the immune system. And last but not least, first responders with symptoms. Why? Because these are the folks that are most likely to get sick enough to require hospitalization. Remember, the treatment for COVID-19 is stay at home, get through the symptoms. It's symptomatic relief. We don't have an antibiotic, we don't have a antiviral, we don't have a vaccine. So the treatment is stay at home. These folks are the ones at highest risk of developing complications that could need hospitalization or maybe even ICU and ventilator care. So they are priority number 2 with testing. Priority number 3 for testing are critical infrastructure workers with symptoms, individuals who don't meet any of the above criteria with symptoms, and then individuals with mild symptoms who are coming from high-risk areas. Right now, we have 6 high-risk areas in the United States. New York State, including New York City, Connecticut, and New Jersey, as well as South Florida, mainly Broward and Dade counties in South Florida, the whole state of Louisiana, the whole state of Washington, and the whole state of California. If you're from any of the hotspot areas right now with symptoms, you are priority number 3 for testing. Now, what about the folks who are just worried? Maybe they had an exposure with somebody who may or may not had coronavirus. Well, I've got an answer for you there. If you go to your iPhone, and I can't help you if you don't have anything other than an Apple product, and you go to the App Store, and you type in the search engine in the App Store, COVID-19, COVID-19. The first app that's going to come up, and I'll go ahead and do that, is going to say Apple COVID-19. This app was developed by Apple in cooperation with the Centers for Disease Control and the United States Department of Health and Human Services. So go ahead and download that app, as I already have. And the first screen will come up and it'll say start screening. And you hit that, and it will go into a series of questions to ask you about your exposure, about your underlying health conditions, about where you live. And at the very end, it will tell you your next needed course of action. So when I plugged myself in there with my list of symptoms, with where I live, with what I do for a living, with my underlying health conditions, my next course of actions were to obey the 3 things that we talked about earlier: social distancing, hand washing, and cleaning of common surfaces. And last but not least, staying at home unless you absolutely have to be out. I know a lot of people's anxiety is high, and truth be told, mine is most days as well. When I get in those high anxiety times, I go back to the recovery principle we talked about at the beginning. I need to control the things I can control, which are myself and my reactions to things, and not worry about the things I can't control. I can't worry about who's getting shut down. I can't worry about what may or may not happen tomorrow. I can't worry about the things that I see on social media. What I can control is me and my reaction. And then the next thing I can do is reach out and try to help people in need, get outside of myself. Those principles have served me well for 16 years, and I think that they will serve us all well during this time of national crisis.